and welcome in to be our guest. And we have one of our favorite people, Dr. Will Rutland. And actually, folks, one of our most precious topics, something that really, really matters that we're all experiencing some way, somewhere, with somebody, and that's mental health. So we have some exciting news about what's been accomplished at our Montgomery Regional UAB Medical School. Yes, there is one here.
There is.
And you are heading up what?
So I have the great privilege of being the new residency director at our UAB campus here in Montgomery, and so I should explain kind of what that means. We are starting a psychiatry residency here, and you may already know this, but just to kind of orient us, a residency is really that period of training where a young doctor or a new doctor hones the specialized skills they need to most effectively help their patients. And what that means kind of in the long line of training is you go through undergraduate school, of course, and then you go through medical school. And then after medical school, every medical graduate in the country will match into a psychiatry or other residency. And of course, we're most worried with folks who want to match in psychiatry here in Montgomery. Now, once they've matched at our program, we'll train them for 4 years to treat all of the major mental illnesses from depression to anxiety, bipolar, major neurocognitive disorder or dementia, psychosis, substance use disorders.
Wow,
everything
substance abuse as well?
That's exactly
wow.
right. And so they'll be coming here to do their training. They'll be with us for at least 4 years. We'll try and convince them to stay around, and we're really going to bolster the workforce here in Montgomery to help treat mental illness.
So when you graduate from our Montgomery campus of UAB Medical School as a
Sure.
resident, are you then a specialist in one area? Is that?
That's exactly right. So, you know, we've got UAB Medical School, which everybody's familiar with here in Alabama.
Right.
And so those are folks that are usually 4 years outside of college. And so they need that extra training to become specialized. And our new psychiatry residency will help them become specialized in psychiatry specifically.
Okay, or something else
That's right.
that we're offering at our residency program. It might be internal medicine.
That's
it might
exactly
be
right.
Gastroenterology or something else.
That's right.
I love that. So, Will, what exactly do you do over there?
That's a good question. So as the residency director, I'm the person who is sort of charged with making sure that our curriculum is set up correctly so that our learners will be exposed to everything that they need to learn over the course of their 4 years. And then, of course, I'm also responsible for helping select the best candidates for our program, folks that are invested in our community, folks that want to stay here in Montgomery and help the people of Montgomery, which, of course, is nearest and dearest to my heart. And so I sort of worry about the human resources side with who we're recruiting and how we get them here to the campus, and then also the academic side. And then as a bonus for me, I also get to be a clinical educator, so I also have my clinics here in town, and I teach the residents here in both my regular general psychiatry clinic, but also in addiction, and so I get to do a bunch.
All right, I know you're humble, and I don't want to embarrass you, but would you give us a little bit about your background?
Well, if you see me blushing, please forgive me, but I am, I guess, most proudly and most importantly, a native son of Montgomery. This is my home.
Right.
This is where I grew up. This is where my parents grew up. This is where my grandparents grew up. And so, first and foremost, I'm a Montgomeryan. But after graduating from high school here in Montgomery, I went off and went to undergraduate in Tennessee, finished that up. I was in Vanderbilt up in Nashville, and as soon as I finished that, I moved overseas to Japan. I had spent about a year in Japan working for the government, came back here, and actually I went to law school. So I was a lawyer before I was a doctor.
Fascinating.
And did that for about a decade, and then determined that what I really needed to do to help this part of the country in the ways that I wanted and believed in helping was to become a doctor. And so I went off to UAB, did my medical school at UAB in Birmingham and here on the Montgomery campus, and then off to Yale to do residency, did a couple of fellowships there in addiction and public psychiatry. And then as soon as I could, I ran right back to Alabama to raise our kids. I have 2 wonderful daughters. In fact, they are responsible for some of the artwork on my white coat here.
I love that.
And so my wife and I are happy to be back home in Montgomery and doing what we're doing now.
Well, I know that you did fantastic work at Yale.
Thank you.
And we are just so blessed that we were able to get you back here.
Well, thanks. I'm very grateful for the time that we spent in Connecticut. I had the opportunity to learn a lot, of course, and I had some wonderful mentors and got exposed to things that have now become very useful for me here in Montgomery. So, for instance, I was on the Connecticut Medical Society's opioid board, and moving back here, I'm able to bring some of that knowledge about the opioid epidemic and the mental health epidemic back here to Montgomery, where it's so desperately needed.
Well, when we talk about mental health in Montgomery, as Jack was saying to us earlier, we have such a plethora of needs in mental health and such a lack of an ability to serve that.
Yeah. It is kind of an unfortunate perfect storm of circumstances. Some of the towering intellects in the field would call it a synergy of plagues, where we have multiple things going on at the same time that are kind of synergizing together. One of those is, of course, the burden of mental illness. So not to bore you with statistics, but roughly 40% of the American population will live with a serious mental illness at some point over the course of their life. Most often that's anxiety or depression, but it can be other things.
Right.
Not least of which are substance use disorders or addictions. And so we know that 2 out of every 5 people in the general population is going to suffer. And unfortunately, that's true here, and we don't have the other side of the equation. The other side of the equation is the treatment. So here are folks who are suffering, but we don't have the treatment to help address that suffering. Alabama ranks 51st in the nation for mental health providers per capita. And so we are at a true disadvantage. We have the same burden of disease that anywhere does, but we don't have the workforce to actually address it, which is why
we have
this is why we're starting a
psychiatric residency. I love
exactly
it.
Right.
And folks, we're going to come back in the following weeks and give you amazing information that will help you, your family, and your friends. And thank you, Dr. Rutland, for being with us. And we'll be right back.